Hello everyone, now let us discuss about 2023 ICD to NCM coding guidelines for chapter 13, that is nothing but diseases of musculoskeletal system and connective tissue. In the chapter 13 we will be discussing about 5 guidelines. The first one is site and laterality specificity. Second is acute traumatic versus chronic or recurrent musculoskeletal conditions. The next is coding of pathological fractures. The next is osteoporosis. And finally, multisystem inflammatory syndrome. Now coming to site and laterality. Most of the codes within chapter 13 have site and laterality designations. The site represents the bone, joint or the muscle involved. And for some conditions where more than one bone, joint or muscle is involved, such as osteoarthritis, a new addition is multiple sites codes are available now. And for the categories where no multiple site code is provided and more than one bone, joint or muscle is involved, multiple codes should be used to indicate different sites involved. Whenever there will be only one code for multiple sites. If that code is available, you need to give that one code only. If multiple sites code is not available, then you have to individually code each bone, joint or muscle involved. Now some of the examples of codes with multiple sites are contraction of muscle at multiple sites. You can see the code is M62.49, and other specified disorders of bone density and structure multiple sites. The code is M85.89. Other specified arthritis multiple sites. The code is M13.89. This is also a new addition. And unspecified soft tissue disorder related to use, overuse or pressure, multiple sites. The code is M70.89. Now coming to bone versus joint. For certain conditions, bone may be affected at the upper or lower end. For example, avascular necrosis of bone, which comes under the category M85, or osteoporosis, which comes under the category M80 and M81. Though the portion of bone affected may be at the joint, the site designation will be the bone, not the joint. This is important. Though the portion of the bone is affected, maybe it is at the joint, but the site designation will be of bone, not the joint. For example, avascular necrosis codes are specified for each bone, not the joint. A classic example is if the physician documents idiopathic avascular necrosis of hip. In that case, we know that hip is a joint and the physician documents idiopathic avascular necrosis of hip. Though the physician has documented a joint name, but actually bone has been affected and the appropriate code is M87.059, idiopathic aseptic necrosis of unspecified femur. Under this code in the tabular section, you will find idiopathic aseptic necrosis of hip NOS. That is, for idiopathic aseptic necrosis of hip, you need to report M87.059, which is nothing but idiopathic aseptic necrosis of unspecified femur. Now coming to next guideline, acute traumatic versus chronic or recurrent musculoskeletal conditions. In simple words, there will be current injury, which is acute traumatic injury, and there will be chronic or recurrent conditions, and there are specific codes that designate each case. Many musculoskeletal system conditions are a result of previous injury or trauma to the site or are recurrent conditions. Bone, joint or muscle conditions that are a result of a healed injury are usually found in chapter 13 with M codes. Recurrent bone, joint or muscle conditions are also usually found in chapter 13. And any current injury should be coded to appropriate injury code from chapter 19. Acute traumatic injuries or any current acute injury should be coded from the code from chapter 19, not from 13. Whereas chronic or recurrent conditions should generally be coded with the code from chapter 13. If it is difficult to determine from the documentation in the record which code is best to describe a condition, then you must query the provider. If you are unclear whether it is a recurrent condition or a new condition, then you need to query the provider. Let us see examples. We'll discuss two cases here. The first one is current injury versus recurrent condition. Here is an example. Patient presents with recurrent patella dislocation of left knee. This is a recurrent condition. As I have discussed earlier, recurrent conditions or chronic conditions, they are present in chapter 13. Patient presents with recurrent patella dislocation of left knee. The appropriate code is M22.02. Recurrent dislocation of patella left knee. Now, second case, patient presents with patella dislocation of left knee. This is a current injury. Patient presents with patella dislocation of left knee. So this must be coded from chapter 19 codes. So the appropriate code is S83.005A. Unspecified dislocation of left patella, initial encounter. Seventh character A indicates initial encounter. So this is an example of current injury versus recurrent condition. Now coming to acute traumatic injury versus chronic or old condition. Let us see one more example. Patient presents with buccal handle tear of lateral meniscus left knee, initial encounter. This is a acute traumatic injury, that is current injury. So this must be coded from chapter 19. The appropriate code is S83.252A. Buccal handle tear of lateral meniscus left knee, initial encounter. Second example, patient presents with old buccal handle tear of lateral meniscus of left knee. This we can find in chapter 13. So the appropriate code is M23.201. Derangement of unspecified lateral meniscus due to old tear or injury left knee. If you see the tabular list of this particular code, you can find under it old buccal handle tear of lateral meniscus. Now coming to coding of pathologic fractures. So before going into what is pathological fractures, let us discuss when we must code A and when we must code seventh character A, D and respective other characters. So first, seventh character A is for the use as long as the patient is receiving active treatment. This word you need to remember. Seventh character A, which is nothing but initial encounter, can be used as long as the patient is receiving active treatment for the fracture. While the patient may be seen by a new or different provider over the course of treatment for the pathological fracture, assignment of the seventh character is based on whether the patient is undergoing active treatment or not. If the patient is undergoing active treatment, if he visits couple of physicians also, then in each case you need to code A. The patient is receiving active treatment. Until the patient is receiving the active treatment, you need to code always A, seventh character A, which is nothing but initial encounter. Coming to seventh character D, it must be used to encounters after the patient has completed active treatment for the fracture and is receiving routine care for the fracture. That is simply healing or recovery phase. D indicates routine healing. And the other seventh characters listed under the encounter for the treatment of problems associated with healing, such as malunion, non-union and sequela, will be discussed in the next slide. And care for complications of surgical treatment for fracture repairs. If there are any complications arising during the healing or recovery phase, should be coded with appropriate complication codes. In case if there are any complications, you need to code the appropriate complication codes. Now coming to pathological fractures. What is a pathological fracture? A pathological fracture occurs when a bone breaks in an area that is weakened by another disease process. This causes the weakening of bone. The causes for the weakening of bone include tumors, infection, certain inherited bone disorders, etc. If reporting a pathological fracture, it is absolutely necessary to make sure that documentation states the underlying cause of the disease. Whenever you are reporting the pathological fracture, you must keep in mind that documentation should clearly state the underlying cause. And along with the pathological fracture, if combination code is not available, you need to code also the underlying condition. In certain cases, there is a combination code. For example, osteoporosis with pathological fracture. Osteoporosis causes pathological fracture. There one code is sufficient. But in case when there is no combination code, for example, neoplasm causes pathological fracture. Along with the pathological code, you need to code the neoplasm code also. Now coming to the various subcategories of pathological fracture codes. The first one is age-related osteoporosis with current pathological fracture. It can be coded from the series M80.0. This is further expandable. The next is other osteoporosis with current pathological fracture. Can be coded from the series M80.8. This is also further expandable. The next is pathological fracture not elsewhere classified. This can be coded from the series M84.4. The next is pathological fracture in neoplastic disease. This can be coded from the subcategory M84.5. This is also further expandable. The next is pathological fracture in other diseases. This can be given from the code category M84.6. This is also further expandable. These are the various subcategories which govern the pathological fracture coding. Now let us see an example. Patient presents for the initial encounter of pathological fracture of right ankle due to bone cyst. Here he is presenting for initial encounter, that is active treatment has not been done. So you must indicate with 7th character A. So the first code is M84.671A, pathological fracture in other diseases, right ankle initial encounter. And the underlying disease or the cause for pathological fracture is bone cyst. So additionally, you need to code also the underlying condition. That is given by M85.472, solitary bone cyst, left ankle and foot. And some of the examples of other diseases that could cause pathological fractures are osteogenesis imperfecta, bone cyst, fibrous dysplasia, Paget's disease, osteomyelitis, and histiocytosis. These are some of the other diseases that can cause pathological fractures. Let us see one more example. Patient presents with pathologic fracture of left ankle due to neoplasm, and the neoplasm is of unspecified behavior. And this was an initial encounter for the treatment of fracture. So the first code would be M84.572A, pathological fracture in neoplastic disease, left ankle, initial encounter. A indicates, 7th character A indicates initial encounter, followed by D49.2, neoplasm of unspecified behavior of bone. Here the neoplasm is of unspecified behavior. Neoplasm of unspecified behavior of bone, soft tissue and skin. Now coming to the next coding guideline, osteoporosis. Before going into guideline, let us briefly discuss what is osteoporosis. Osteoporosis is a systemic condition, meaning that all bones of the musculoskeletal system are affected. Therefore, site is not a component in the codes under the category M81, osteoporosis without current pathological fracture. Osteoporosis is a systemic disease which indicates that all bones of the musculoskeletal system are affected. Therefore, there is no component for the codes under the category M81, that is nothing but osteoporosis without pathological fracture. Osteoporosis with pathological fracture, they have site specific codes. because you need to code the pathological fracture. But osteoporosis without current pathological fracture does not have site-specific codes indicating each bone, because it is a systemic condition, so that we need to assume or presume all bones of the musculoskeletal system are affected. The site codes under the category M80, osteoporosis with current pathological fracture, identify the site of the fracture, not the osteoporosis. This is also important. The site codes under the category M80, they identify the site of the fracture, not the osteoporosis. Coming to the further details regarding osteoporosis, osteoporosis occurs when bone loses its density. There will be loss of density and it becomes thin and brittle. This can lead to fractures from falls or minor bumps or stresses. Usually a healthy individual may not be prone to fractures more often, but the persons, once they are diagnosed with osteoporosis, they are prone to fracture from simple minor falls and bumps. So once a person diagnosed with osteoporosis, and if he falls and is diagnosed with fracture, then by default you need to code osteoporosis with pathological fracture. You need to assume a cause and effect relationship with osteoporosis and fractures. They are more prone to fractures. Patients with osteoporosis, they are more prone to fractures. So once a patient diagnosed with osteoporosis, and if he comes for the treatment of fracture, you need to code osteoporosis with pathological fracture, provided the physician should document that it is a pathological fracture. But in majority of the cases, you can assume it as a pathological fracture, but documentation is also significant. While coding osteoporosis, appropriate seventh character be added to the code. A indicates initial encounter for fracture. D indicates subsequent encounter for fracture with routine healing. G indicates subsequent encounter for fracture with delayed healing. Seventh character K indicates subsequent encounter for fracture with non-union. And seventh character P indicates subsequent encounter for fracture with malunion. And seventh character S indicates sequela. Now coming to the guidelines of osteoporosis. There are two guidelines: osteoporosis without pathological fracture and osteoporosis with current pathological fracture. Coming to osteoporosis without pathological fracture. The category M81, osteoporosis without current pathological fracture, is for the use for patients with osteoporosis who do not currently have a pathological fracture due to osteoporosis, even if they have had a fracture in the past. An osteoporosis patient might have had a fracture in the past, but currently he is not having any pathological fracture. So you need to code from the category M81. Additionally, for patients with a history of osteoporosis fracture, you need to indicate a status code M87 Z87.310, personal history of healed osteoporosis fracture. It must be coded along with code from the category M81. If the patient has history of osteoporosis fracture, then you need to indicate a status code Z87.310 along with the codes from the category M81. Now coming to the guideline, osteoporosis with current pathological fracture. It comes under the category M80. Osteoporosis with current pathological fracture is for patients who have a current pathological fracture at the time of the encounter. And the codes under M80 identify the site of the fracture, not the osteoporosis, as we have discussed earlier. And a code from the category M80, not a traumatic fracture code. This is important. A code from category M80, not a traumatic fracture code, should be used for any patient with known osteoporosis who suffers a fracture, even if the patient had a minor fall or trauma. If the fall or trauma would not usually break a normal healthy bone. So this is a guideline. A code from category M80 should be used for any patient with known osteoporosis who suffers a fracture, even if the patient had minor fall or trauma. Now let us see the various subcategories of the codes which cover the osteoporosis. Osteoporosis, as we have discussed earlier, it is broadly categorized into with the pathological fracture. Osteoporosis. O indicates osteoporosis, W indicates with, C indicates current pathological fracture. PF means pathological fracture. Next is without current pathological fractures. So with osteoporosis with current pathological fracture, it is again divided into or subcategorized into age-related osteoporosis with current pathological fracture and other osteoporosis with current pathological fracture. Age-related osteoporosis with current pathological fracture is indicated by the code series M80.0. This is further expandable. Age-related osteoporosis with current pathological fracture is given in the category M80.0 and this is further expandable. The next is other osteoporosis with current pathological fracture. This is given in the series M80.8. This is also further expandable. Now coming to osteoporosis without current pathological fracture. It is again subcategorized into three types. Osteoporosis without current pathological fracture. Age-related osteoporosis without current pathological fracture. This is given by the code M81.0. This is the final code. The next is localized osteoporosis. This is given by M81.6. The next is other osteoporosis. This is given by M81.8 and these are further expandable. This category is further expandable subcategory. Now let us see an example. Postmenopausal osteoporosis with current pathological fracture. Left humerus, initial encounter for fracture. Patient presents with postmenopausal osteoporosis with current pathological fracture, left humerus, initial encounter. So the appropriate code is M80.022A. Age-related osteoporosis with current pathological fracture, left humerus, initial encounter for the fracture. Finally, coming to the final guideline, multi-system inflammatory syndrome. This is covered in the chapter 1 under COVID guidelines. So basically we have three scenarios here. For individuals with multi-system inflammatory syndrome and COVID infection, COVID-19 infection, active infection, first you need to code U07.1 as PDX followed by M35.81 to indicate MIS, multi-system inflammatory syndrome. The second scenario, if an individual with a history of COVID develops multi-system inflammatory syndrome, then first you need to code M35.81 as PDX followed by post-COVID condition code as SDX, U09.9. Third scenario, suspected exposure. Patient has suspected exposure of COVID and develops multi-system inflammatory syndrome. So their PDX will be M35.81 followed by Z80.822, suspected exposure code. And any codes, additional codes should be assigned for any associated complications of multisystem inflammatory syndrome. Along with M35.81 code, additional code should be assigned for any associated complications of MIS. That is nothing but multisystem inflammatory syndrome. By this, we complete the guidelines for chapter 13. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.